I'm very, very thankful that she volunteered to do this so you could hear it from an actual person who's gone through treatment here at our clinic. And first of all, I think now it's time to close the door. To keep in mind that it takes a lot of courage to come and do this, right? But most important, when we were talking about this, I was telling her about how valuable it is to have someone tell us about what they've gone through and the different steps that have taken for them to recover. In this case, depression. Right? With someone who's so high functioning, right? You usually think of someone with a psychiatric or mental disorder to be very disabled, right? And even though you can be temporarily disabled, most people get back to functioning 100%, right? So usually when people hear psychiatry or mental illness, they quickly think of schizophrenia, losing your mind, or bipolar mania, or mania with psychosis, things like that. But if you think, just so you have an idea, the prevalence of schizophrenia is 1% of the population. Bipolar disorder, between 0.5 and 1%. And in comparison with that, depression is 12 to 14%. So, and anxiety, it goes up to 16, 18%. So, when you put them all together, about a third of the population either has or will have some kind of mental disorder. If you add substance use disorder, it goes up to 40%. Like that. So, Catalina is going to tell us a story, her story, about one of the most common conditions and how she ended up here with us, what she's doing now, and how it went. So we prepared about a 35-40 minute talk. Feel free to interrupt as we move forward, but we're leaving a lot of time for you to ask questions. Okay, Catalina, thank you again, and you're on.
Well, thank you. It's a pleasure to be here. Like I was telling Dr. Ng, if there's one person I can help that's in this room, it's all worth it because it's a very personal story, reality story. It's not like on TV where you see things and it's not real. This is a real story. Well, I want to give you a little bit of background about who I am, where I come from. I'm not from Imperial Valley. I was born in the Mojave Desert. My parents are just typical Hispanic, hardworking field workers. And I worked in the alfalfa fields until I was 18 and graduated from high school. I moved here when I was 20 years old. I have 2 children, a girl and a boy, 1 granddaughter. I'm married, and I had been working for the same organization for over 44 years. I retired 10 months ago. And I'm so excited to be retired. Now I'm living life. But how did all my depression start? Well, I was telling Dr. Ng that I know how it started because I was one of those people that liked to journalize what was going on in my life. So I remember I would be jogging, because I was a jogger in track in high school. I would jog and I'd go running or walking or jogging. And I remember it started to get difficult for me to get further away from my home because I would run from my house to around the fields. Here I live in Raleigh. And it was getting very difficult. So then I started jogging closer and closer to my house and started having a lot of fear and a lot of anxiety. And then I would go to work and I wasn't happy. It was like I was beginning to feel sad and I wouldn't want to go to parties. And then I noticed I couldn't open the mail because I was responsible for our department's mail, and I couldn't open the mail. I just couldn't open. I wouldn't go to my P.O. box, and I wouldn't go to my P.O. box for weeks because I didn't want to open the mail. It's just so crazy when I think about it now, why it would be like that. So then, when I was walking, I couldn't even get to the end of the street for my walk because I was just too far away from my house. I was scared. It was horrible. It's a feeling that you never forget. So I was desperate. I felt that I couldn't breathe, like I didn't have enough oxygen to breathe. So I knew I needed help. I just knew it. So what I did is I picked up the phone and I called behavioral health. And I didn't get in for about a week. They couldn't see me for about a week. And with a psychologist. And she saw me. And when she saw me, whatever she saw, she says, you need to see a psychiatrist today. That's how bad things were. So I had to wait for hours for this appointment, and I finally got in, and he right away, I had lost a lot of weight as well, and I was having trouble at work. So he right away put me on some medication. And of course, I have a son that's a millennial.
A son who's
a millennial.
millennial.
And millennials know everything, right? They know everything, and he was so against me starting the medication. And I was one of those people too, that if you had a headache, I wasn't gonna take a aspirin. I just, one of those people. So I was real hesitant to do it. But I was really desperate, so I started taking it. And of course,
So, Catalina, let me interrupt you.
Yeah.
From the moment you said it the first time that you would go around and started getting closer and closer to the day that you actually called and showed up at behavioral health, how much time went by?
It started in December when I started feeling like this, and my first phone call was February 11th.
Okay.
February 17th,
Which
2011. February
Journaling,
16th.
that way.
February 16th, 2011.
So a couple of months.
A few months. It got really bad really quick. Really quick. So I started different medications, and a lot of different medications weren't working, and I didn't know what was wrong, and I wasn't feeling any better. I never have felt suicidal. I've never wanted to take my life. I just was very sad, very, stayed home a lot. And I was bothered by company, I was bothered by the phone ringing, I was bothered by the texts. I didn't answer my phones. And my brothers would want to come over, and no, I don't want you to come over. It was just really, really bad. So it continued like that for a while. So I was just telling doctor, it went on for years actually with different medication, and then I would get better and I would feel better. And what would happen with some of the drugs apparently is that you start to like wean off of the drugs, and then it's like you're not really taking anything. So then you got to find another different kind of medication that may work, right? But I was just telling Dr. Ng that in 2019, his office asked if I wanted to do what they call a MAP test, M-A-P-P. And it's a test it's a swab test, and you take it, and it comes back and it kind of highlights what kind of medication is probably better to work for you than not. Well, that test, when it came back, I was put on the medications that needed to be done. And the rest is history. What can I say?
So let me interject there. She was telling me if during the tour we would be telling you about that, and reminded me that we chose not to do that because when we were planning the tour, we didn't have a vendor. So let me tell you what it is. The swab test is very similar to the DNA test that you see on CSI. Right? So you get the sample, and we collect the sample, we send it out, and they check your your genetic ability to metabolize medications. And it's not a cheap test, but it's very valuable. So when we as doctors run into someone with a history like Catalina's, where they do take the medication, but after a while it quits working, or the regular dose does not seem to be working, it's indicated to get that test. So It's very similar to those tests that we do in the hospital for people who have infections. And then they say, okay, we were able to grow these streptococcus of some kind, and then they put little samples of antibiotics to see which is the one that kills the bug. So it's similar, but for antidepressant medication. So, but kind of backwards, because now it tells you your enzymes, how good are they at killing the antidepressant, right, or breaking it down. And that explained a lot of things as to why she would take the medication and not get the best results. So yeah, based on that map, we changed the prescription. And let me add, as when you say it's history, that these last couple of years were about preparing for retirement.
Yes.
Yeah, tell us about that.
Okay, so my family kept asking me, when are you gonna retire, when are you gonna retire? You know, I'm gonna be 100 years old and I'm still gonna be working, because I was just a workaholic and loved my job, it was my passion. But it's kind of like you kind of know when you need to retire. So I was telling Dr. E, you know, I'm gonna retire, but my kids are really worried, like, what are you gonna do when you retire? Like, you know, you worked on the weekends and you worked, you know, 10 hours a day, and like, what are you gonna do? Like, what's the plan? So I started to worry a little bit, like, yeah, what am I gonna do? But I was tired. I was tired of working. 44 years and 3 months. You know, I was counting the days. So I told Dr. Ng about that, and he goes, yeah, okay. So in the interim, the medications were being decreased, because I was doing so well. I was doing really well.
And she was eager to get off the medication.
And I wanted to get off the meds because I was feeling so good. So I told him about my retirement, and he said, well, hold on, just wait a minute. This is a big transition. Let's see how you do when you retire. Let's see how the next few months go for you. Are you going to be okay or not? You know, because it's a big transition. As a depression, you kind of have triggers. You kind of have, you got to do a self-check and see, am I okay? Am I feeling okay? Am I still enjoying the things that I'm doing or not? So I really, and I was just telling Dr. Ng, I wasn't one of those patients that would come in and most people would say, you know, how are you doing? Okay. How are you feeling? Fine. Bien. Igual. You know? No, I wasn't like that. I told them how I was really feeling and how it was, like I was saying, the anxiety was the biggest part of my depression. You know, where I couldn't breathe and I was having panic attacks and anxiety attacks, and it was just really bad. So he said to hold off, and so I did. And then he saw me, oh, you're doing great.
Playing bowling.
I started my own bowling league, new car, named my bowling team Top Gun, you know. I just have a lot, you know, I just had a lot of things going on, and I love spending time with my granddaughter and having, you know, outings and just doing a lot of different. I made a couple of blankets, you know, blankets, you know, I'm out there, you know, trying to race cars and stuff with these sports cars, but you know, I'm having a wonderful time. And so anyway, the medications were decreasing, and I started feeling I'm okay. And so Dr. Ng, I think we should start even more because I'm ready to, you know, I'm doing really well. I'm doing really good.
Let me ask you a different question. Could you, fortunately, you've been very healthy otherwise, right? Except for
I am a diabetic, but healthy.
Yeah, so here comes the question. Of the different health conditions that you have, how would you list on the ones that have been that have caused more impairment on your ability to work or enjoy your life or having a quality of life? How would you list them from worst to least?
The worst was in 2011.
But
that was the
which
worst.
Condition of
the anxiety.
Okay.
The anxiety was the worst. The fear, the panic attacks where I couldn't breathe, just being really sad. Not suicidal, but did I want to be here? No. It was just like, this is not worth it. Life is not worth it. But You know, I'm trying to get better and better, but that was the most hardest thing for me, was getting over my anxiety and my fear.
I wanted to ask you that because sometimes we underestimate, because you know, a mental illness is not something you can find on an x-ray or find in a blood test. And you know, diabetes is very easy to diagnose and understand, and your hemoglobin A1C, and how is your retina, and how are your kidney function, things like that, right? But when you think about it, how long have you been a diabetic?
11 years?
11 years, right? So if you put it together, actually, a mental illness can be more disabling or more impairing than
Yes.
having a disease. I mean, diabetes is a very disabling disease too, right? But it turns out that when you put one next to the other, the anxiety could cause more impact in your life.
Yes, and you're at higher risk as well to get depression if you have diabetes. But, Dr. E, my doctor told me at the last visit that my A1C is so good that I may be considered non-diabetic.
Oh, wow. Really?
You know, yes.
You hadn't thought
And
about
I
that.
didn't even wow, but he did tell me I had to lose some pounds, right? But if I lose the pounds, he's gonna, I don't need to take my medication, my metformin anymore.
So getting off more medication.
Yes,
Okay.
I'm telling you, I'm doing great.
So let me ask you about this. You were very clear about saying I was never suicidal, but I felt so bad that I did ask myself, why live? Expand a little more on that. What is it a thought that suddenly comes in your mind? What do you tell yourself when you're thinking that? How is that?
Okay, well.
It's a difficult place to be in, right?
Like I said from the very start, it's something you just don't forget. Because it's like if you're drowning and you want to take a breath and you just want some oxygen, that's how I felt. I felt like I needed some oxygen. And my family has always been very important to me, and I would always think about my family. I have 4 brothers, 4 wonderful brothers. My parents have passed on. But my family, my husband, my children, my granddaughter is the most important person in my life. And those things I would think about all the time when I was going through these hardships. That kept me going. But at one time, like I told my son, I didn't want to see my granddaughter. I really felt I was contagious. I felt like if she saw me, she could see depression all over me. I just felt like I was gonna infect people around me. And you do, depressed people infect people. They really do, and nobody wants to be around you, and you're always, you're just Debbie Downer, all the time. And so I stayed away from her, and I won't forget those weeks either, because time is too precious. So every day is just such a blessing.
In all this time, Catalina, was there any time that you were completely off work for days
Oh,
at
yes.
a time?
Months at a time.
Oh,
yes.
Really?
Oh, yeah.
What was the longest time you were out?
The longest that my job let me be off was, I think it's 12 weeks. After 12 weeks, they can let you go. So that's the law where I worked. So you could only be off for 12 weeks, and not 12 weeks in one day, you could be asked to leave. So 12 weeks at a time. I took all 12 weeks because 12 weeks didn't seem like it was enough for me, but I had to go back to work in it. And when I did start work, it was only part-time. I would start 2 hours a day. And I was very fortunate to have an employer that would accommodate without any hesitation. If you're a hard worker, good worker, they want you.
That's a message for employers.
They want you. They want to keep you.
So let's we're moving towards the part where you can ask questions. But if you had someone in front of you, Catalina, who has confided in you that has had anxiety or a panic attack, or has been off work and does not know what's going on, and is suspecting that could be depressed, yet hesitant to seek help, how would you go about encouraging? Because I mean, you would encourage that person to seek help, I suppose. What would you tell that person?
I've encouraged people
You
even
have
today.
already.
Yeah, even today. I went to physical therapy because I tore my rotator cuff 7 weeks ago.
From what? What?
Oh, a mechanical bull did the trick. On December 31st, but I had already had some pain. But I had to start the year off right? But I didn't. But you know, and they asked me, would you do it again? Yes, I would. It was so much fun. It was a lot of fun. You know, so I forgot what was the question.
Yeah. Even today, you recommended.
Oh, even
in
today,
physical therapy.
yeah, in therapy, I said, you know, I'm gonna be doing this talk on depression. She goes, really? She goes, oh, well, I've been depressed since 2019, when COVID hit. That was the other thing. When COVID hit, I said, oh God, everybody was so, a lot of anxiety, and I thought I was the queen of anxiety, right? So I did, I really, but I did wonderful, because you learn these tools. At the same time I was seeing you, I was also seeing a psychologist, so that's also very important, that you just not see your psychiatrist, but also talk to your psychologist, because they give you some like
tools?
coping mechanisms for you and tools to use. Like at work, people would always come to me with their problems, and she would tell you, what, your tolerance level is not what it used to be. And you don't need to engage in their problems, you don't need that, because you can actually fall back into your depression. So, close your door to all of it, you're no longer gonna be doing that. So just different tools that you can use, and find out as much information by reading and with other people, their experience, because once you have this depression, it's amazing how many people are going through hard times and have depression. And it gives you a lot of compassion for people who are going through it, that you can talk to and help.
So you were telling that your therapist.
My therapist, I said today, and she didn't say I wish I could go because she's at work, but we talked afterwards, and I told her about the MAP, the MAP.
That made a big difference to you.
To me, it made such a big difference, and that's what I talk to people about, because I didn't have time to figure out which medications were working. I just felt like very important statement. I said I never felt suicidal, but I felt like I was crazy many, many, many times. Like I'm crazy.
That's a very scary.
I'm just so crazy that I would get in my car and drive, to 120 miles an hour, just on a straight path, just fly. I was just crazy, and I didn't care if I died. I didn't care if you're crazy, crazy doing stupid things like that. You do stupid things. So I've been crazy to that extent. So.
And what did the therapist say? What your
Besides, don't do that.
recommendation was? Yeah. Your recommendation was.
No, you need to do a self-check. You need to make sure that you're not putting other people at risk. You're putting other people at risk. And you need to see your doctor, because, whatever you're on, you need to tell someone. You need to tell an expert about what you're doing and what you're feeling, and I did,
Let me take on that, because we talked about stigma and myths and fears about seeing professionals like us. How would you explain that to someone who's never been to see one of us? What is the experience like to be seeing a psychologist, a therapist?
At the beginning, I was like, shh, you're seeing a psychiatrist. Don't tell anybody I'm seeing a psychiatrist. Just the stigma is just very. I'll tell anybody that listens. Dr. Ng is my doctor, and like I told him earlier, I would not be here today if it wasn't for him and his staff. The staff is very, very good. I would call, like once I thought I double dosed on a medication, I think I took twice the amount that I needed, and I called him. He said, if you get a bad headache, you need to go to the ER. If you start with a bad headache, what you need to do. So, you know, when you call, somebody's gonna respond to your concern, like, am I gonna die because I took 2? I mean, I didn't know, you know, I don't know what I'm going through, so, yeah. So, I'm just wonderfully so thankful for Dr. Ng.
Now you see why you met her. She volunteered and I
He
took
didn't
credit.
ask me, I asked.
She volunteered and I quickly said yes. Okay. I still want to ask you something else, but I want to give an opportunity to people here. You see how good she's explaining the story, but what else would you like to know about the experience?
You mentioned that you were journaling, and so then you kind of started recognizing the change in your behavior, and that was years ago. But do you know what your primary trigger, what was it that really caused
Interesting
you
question.
to really start feeling
Early on.
Yeah. What I noticed for doing this talk today, I went to my journal, you know, it's been 2011, like, you know, what happened, what triggered? Well, the year before, my mother had passed away, and she left me a special needs brother that is still on my plate, but it's your attitude towards that, you know, I was so angry about all that. And then that same year, I was diagnosed with the diabetes. So those two things together, I think, is what led to how I was feeling. And for many years, I seemed to always get down during the holidays, during Christmas. It seemed like they called it seasonal depression kind of thing, but it wasn't that. It just happened that when things happened, you know, those two things. So that's the initial, what I learned actually going back a few days ago was maybe those were the 2 triggers, because I've never really even went back to think about the triggers. And it's really good to journalize, because otherwise I wouldn't remember what the heck I was doing or what I did. Because what I wrote was horrible. A lot of things that I did, you know, driving so fast, stupid things like that. I forgot about all that. So,
Do you, well, if you guys have another question, I already have another question. No?
I do have a question.
You do have a question? Go ahead.
Yes. Like going back, other than medication, what do you think helped you the most? Or let me ask you this in another way. Like, when you were experiencing like the worst part of the depression and the anxiety, what would you think would have helped you to be better? Like, because sometimes I have heard people telling someone that has anxiety, like, don't be anxious about that, like, you know, like phrases or things that it's like saying an asthmatic person, just breathe. Like, I know what I should do, but it's not easy for me. Like, what is something that you feel might have helped you during those times? Like, for someone that loves you and want to be there for you, what will be something useful for them to do? Because sometimes we don't know how to approach those situations. Even though we have the best intentions, we don't know how to. So what do you feel will have been something good for you?
I wish somebody would have told me, you know what, you need to go get some help. When I saw that psychologist for the first time on February 16, 2011, I remember, you know, she said, oh my gosh, I remember her attitude was, you're just suffering. You're suffering so much. She felt so bad. She kept using the word suffering. And I was suffering so bad. I can't tell you how much that word means to me, because it's just nothing but suffer. So if I would have been told, you know what, go see a psychiatrist, go get some help. I was the one that picked up the phone. Nobody, because the stigma then was, you know, you don't get over it. You know, get over it.
Exactly.
You know, why'd that piss you off? Just get over it. You know, it wasn't working, and I knew the tools. You know, you need to exercise. You need to You know, have a supportive family. You need to go out more. You need to do. I was doing all. I was, exercising, doing all these things, and nothing was working. And I knew that those are all the things that you should do when you're going through a depression. But my father was a depressed person. He went through that for years too. So I had a little bit of experience with that as well. So, but again, I don't want to be like my dad going through a psychiatrist. I'm not stupid. I'm not crazy.
So how do you make the decision?
I was desperate.
You were desperate.
I was desperate. That's the word I can tell you. I was so desperate to get help. And when she told me I couldn't get in for a week, oh my God, how many minutes is that? I would just count like the days. Oh my God, it's one day closer to my appointment. So it was just suffering, so much suffering, a lot of suffering. And they right away that day put me on disability. I didn't go back to work for months. I was that bad,
It was very clear.
And like being, I'm not trying to my self-image is, I was a hard worker. I knew I could do this. I knew I could beat this. I can do this all on my own. Nobody's gonna tell me how to get better. Nobody. I can do it on my own. Not true. I believe, like my son asked me the other day, is depression, are you cured? How do you know if you're cured? That's a good question.
That's a good question.
It's a really good question. Well, that's a good question, I said. I said, no, there's no cure for depression, but I feel like I am cured. That's what I said. I feel like I am. Yeah.
Is there any other question? Because I do have a question. Well, you guys think of that. I want to go back to the episode where you said you were driving and doing something crazy, and you said, I didn't care what happened. Because at the same time you said, I never thought of killing myself. But that sounds very risky. So what else can you remember about what was going through your mind when you said, I don't care what happens, you could have an accident and die?
Yeah.
Right?
Well, I still have a love for driving fast. Okay, so
Well, yeah,
it's used to.
training.
That's my
She's
thing.
training with a sports car, but that's in controlled conditions.
Yeah,
You're
but
gonna be-
but I felt like I have control over my car. I got steering wheel. I'm gonna tell it what to do and when to stop, all that. I'm in control. Nobody's, I have those steering wheel, I have the brakes, and I have the accelerator. So I didn't mind. If I was gonna have an accident, I wanted to make sure that I was gonna die in the accident. I didn't wanna,
So you were sort of flipping a coin, maybe
Yeah,
maybe.
if I do, I don't care. I was at the point where I don't care.
And that's.
But I didn't really want to die. I didn't want to die.
I wanted to take on that
Yeah.
because it's one thing that does become a heated debate sometimes. Like in emergency psychiatric services, is the person really suicidal or not, right? And we struggle through that because, as you heard on the previous talk, sometimes you may qualify for a 5150 or not, depending on the assessment, the person who's doing the assessment. What I believe is that more important than that is to realize that a person does not just think one day, I want to kill myself, or I don't want to kill myself. Is the clinician that first saw you that used the word suffering, it comes out of that suffering. You feel so bad that you might not have a plan exactly about how you're going to do it, but the fact that those emotions are going through your mind are a result of an illness that has affected your brain and has distorted the way you think, right?
It's distorted, but I felt better. Driving fast.
Oh yeah, you.
I
you're
felt
looking
really
to feel
good.
better.
Yeah,
You're
I
wishing-
felt really a lot better. As crazy as that sounds. Not that I recommend it to anybody. I
No,
don't recommend it at
it's a
all.
therapeutic tool.
No, it was like 1 a.m, nobody's out there, I'm doing it all on my own, it's that kind of thing. So,
You were saying something, Eric?
Well, it's a risk experience, it's a limited experience, so it produces a lot of those feel-good substances in the brain,
Oh,
like adrenaline and norepinephrine, those kind of things. So
Dopamine.
you're pumped up with those substances, you feel great. It's normal when you are in limit situations. Taking it back to what we were saying about the suffering occurring, it's there's not a normal evolution pathway for disorders. You know, it's not like a linear process that if you fulfill A, B, and C, then follows D. It can paroxystically escalate. So people can be suffering for a long period of time and not even contemplate suicide, and then the next day your tragedy hits and you have like a homicide-suicide situation happen. So yeah, I mean, it's not necessarily something that can be predicted. So the clinical decision is very difficult.
Let me take advantage of what you said about, you're looking for those good chemicals somehow and connect with that of how easy it is during those times to use substances to feel better, right? Because you are trying to find how to feel better.
help.
And if at that time you're very anxious or whatever and you drink a couple of shots of whiskey and it turns out that they help you, well, you want to do it the next day. And you want to do it a third day and a fourth day. And well, now it's probably the most common thing is to get marijuana in some of the multiple presentations there is, because it makes you feel better even if it's for a couple of hours and you look for that. It's very easy to get into those habits that can turn into another disorder. And
On one occasion, I did. I don't drink normally, but I got a beer, one beer, and I drank it I wanted to feel better, right? I don't know how to put this, but I took it and I felt so much more depressed. I mean, for me, I was just like, I didn't
One
think I
person's
could-
medicine's another's poison.
I just thought, I can't get any more depressed than I already am, and I'm
doing it to myself.
oh my gosh. So I stayed away from a beer for, not that I don't do it now, but.
But you're feeling good.
Yeah, I'm okay, but, yeah. But I hope I have answered your question,
Yeah, you did.
ask for help, And I
Yeah, because
cannot stress enough that MAP test.
I was asking because I'm a physician. I'm not a psychiatrist yet, but I have treated patients. And I often encounter patients when they are at that point where they are like bad enough to seek help, but good enough to be able to arrive to
Function,
yes. But sometimes what I wanna, because you wanna treat like the patient of course, but you wanna make the environment for them safe. And usually they have someone that really, really cares for them, but have no idea how to help them. So it's not appropriate to ask during the consultation like, hey, what do you want your sister to tell you? Of course not. So I was thinking, let's ask her that she already like passed the situation, like going back, what will be something that might help when you approach them? Because of course it's not easy to be there, right? Like maybe your father or your sister or your daughter or son want to be there for you, but they don't know how.
that's true.
And they don't have the opportunity to have like the resources to learn how to do it. They have to learn in the past
As they go.
as they go. So
Well, we're almost out of time. If you guys have any other questions.
I got a quick question. So you seem really confident right now. Are you relatively sure that you're not going to return to this state? That somehow it is like in your rearview mirror? And I mean, sometimes I wake up from a bad dream and I think, well, I better stay awake. Because if I go back to sleep, I'm going to go right back into the dream again. How do you feel? I mean, you seem confident. What gives you the confidence?
I haven't talked a lot about, my life, there's been a lot of tragedy. And a lot of things that are going on that are not good sometimes,
Even that.
even now. with what I've learned, with the tools that I have, people say, don't worry. I don't worry. I just don't.
Literally, don't
It's-
worry.
I don't worry, but it took years of practice. And I have a lot of faith. I am a Christian, I have a lot of faith. I've always had the faith, but I just don't worry. I feel, life is precious every day, and I really take advantage of every day. You wake up every day like, it's a blessing. And so I feel confident, and I thought about your question, like if I were to can I get depressed again? Of course, I know that, but I know enough now, the triggers. I know now how it feels, and if I'm going, like with Dr. Ng, I would, I'm not feeling so well, you know what, you need to, we downed your med, let's go back. It's so important to communicate with your doctor how you're really feeling. And don't wait like me when you become desperate. So yeah, I feel really good about my life. I feel really good, and Dr. Eamon told me, you know what, when you retire, you're gonna feel even better. And I'm like, I love my work. It's my passion. I love my life. I love my retirement. I look forward to every day. I love my family. I'm just happy.
Like a walking, talking antidepressant yourself.
Thank you, Catalina.